Thank you for the report on this patient, doctor. Based on what you told me, I understand that this patient has been having regular painful contractions for about 2 hours now. And on your exam, you found that her cervix was long and closed, which is definitely reassuring. However, given her history of two preterm births, I am a little uncomfortable with sending her home. Without a few more tests, I would like to suggest a few things that we do to ensure a safe discharge for her and that we don't miss anything. I'd like to complete a physical exam to determine if there's any indications of why this is happening or if there are any other problems going on right now with her. I would also like to suggest getting an endovaginal ultrasound to check her cervical length, and if it is 30 millimeters or less, it is recommended we follow up with a fetal fibronectin test, since a negative result would be reassuring that she's not likely to go into labor within the next week or two. I'd also like to consider checking for things like a UTI, STI, or even dehydration, since those have been shown to cause contractions or sometimes even preterm labor. So, testing and evaluating for those would help rule out any specific causes. Additionally, with contractions at this gestation, we should ensure the health and safety of the fetus by doing a fetal non-stress test, just to check the baby's activity. And this, I think, would help reassure both the patient and the care team. If we find any possible causes for these contractions, we can treat them now, or I think we can at least continue monitoring her until the contractions either slow down or stop completely. When it's safe for the patient to be discharged and she feels comfortable going home, I can educate her that follow-up is recommended in a week, unless she starts to experience any signs or symptoms of preterm labor or any other problems. She should return to the hospital even sooner. I also think before she leaves, we should consult maternal fetal medicine if they're not already on board with her care, just because of her history of preterm labor, she is at higher risk. And then I also wanted to ask you about your uh, strict bed rest recommendation. Most recent research, as well as the ACOG guidelines, no longer recommend strict bed rest based on most of the literature that I've read, as it can cause problems like muscle weakness, bone density loss, reduced cardiovascular function, blood clots being a big one, and even having a psychological toll on the moms, like depression, frustration, and it's been found that most of these problems can cause more harm than good to the mom. So while strict bed rest isn't recommended anymore, it definitely is important to tell and educate the mom that she needs to take it easy, try and reduce any stress that she may have. Don't overexert herself, as all of these can contribute to her risk of preterm labor. I also want to make sure that I educate her on paying attention to preterm labor signs like her water breaking, spotting, bleeding, cramping, or contractions again. And then if she also has any problems such as decreased fetal movement, headaches with visual changes, she should also seek treatment for those as well. So those are the um, proposals I have for some additional tests or uh, changes in plan of care that maybe we can do that I think have the patient's best interests. Um, and I would love to hear any questions you have or any concerns you have or any thoughts that you have on the things that I've presented. Thank you.